As we all know, a good diagnosis depends on the accuracy of the information a doctor receives. This is especially critical for our high-risk patients. That's why at UnityPoint Health Cedar Rapids, we asked ourselves, how can we stay better informed about what's going on with our patients? How can we be more proactive to keep them out of the hospital and thriving at home? That's where the idea of care coordinators and the advanced medical team came from. So we could have someone on the care team be our eyes and ears, so we wouldn't have to wait for the patient to come to us with a problem. Because by that time, it's often too late. We needed to get to them, to make sure the patient followed the care plan, to see how the patient responded to treatment. Here's our story.
I have emphysema, COPD, that whole deal. I quit smoking 2 years ago.
About a year and a half ago, he was diagnosed with early stage dementia.
If I go outside in the cold, it took my breath away.
My father died of emphysema, and we watched that. And so I had a hard time understanding, although I'm an ex-smoker. But when he did quit finally, I was really excited, and I couldn't believe it. And I made him show me that he threw him away. But yeah, and life was really rough. I mean, he was not doing well. I worry about him a lot. I know that he gets scared because he'll tell me he's scared, you know. But I would be too. If I couldn't breathe, I'd be frightened.
I didn't like it. I know that. I knew I had to do something to take care of this. I was in the hospital like 4 or 5 times a year. It was that bad. I don't remember half of it because my oxygen was so low.
I first saw Kevin when he was hospitalized with an exacerbation of COPD, shortness of breath. In the last 2 or 3 years, Kevin's situation became more difficult, and it was more crisis to crisis management. We sat down and talked about what his problems were, not just his lung problems, but what were some of the social issues, what were some of the communication issues involved, and why we weren't having success. And we came up with a strategy of more frequent visits, identifying the care coordinator or nurse navigator as an easier point of contact.
The doctor is the director of the plan. I mean, he puts the plan together, and then we work to carry that out and improve it as we go along.
There was a lot of confusion about what was going on at home, his medications. Kevin was on 35 medications at the time, so that was a lot. We worked with Lori to establish a way to communicate with her. I would just reach out and ask Lori, are there any concerns or issues, and get that feedback. And then with Kevin, ask him how he's doing, if he has any questions or concerns.
We just have to know when, to call the doctor ahead of time and things like that, so that we can avoid, any hospitalization.
She's really helped us out a lot.
Anything I need or need to check on, she's right on it. She will check in on us, just send an email once a week usually, just to see how are things going, is there anything I can do for you. She's just been great. I can't even say how great she is.
Kevin's wife, Lori, also communicated quite frequently with Joellen about different things that were going on. Make sure that they have their meds. If they're not following their medication schedule, what's going on? Can they not afford it? Do they not like the side effects? Do they not know why they're even taking them? So we try to be the person that they can talk to about their meds.
And what we've seen then is that there are fewer phone calls to the office, there are fewer crises. When problems arise, we're able to intervene sooner. Kevin's overall health has significantly improved.
Overall, it's made a huge impact for him. He's taken an ownership in his health.
I think that he's done a lot better. Oh, he's so much happier.
It's getting better all the time.